Ophthalmology is an amazing field that's always been on the cutting edge of new technologies. I mean, if you take a quick snapshot through time, one of the things that got me interested in ophthalmology in the first place is they were among the first people to use an operating microscope. In ophthalmology was the discovery of the first tumor suppressor gene in retinoblastoma. With one of the more recent revolutions in genomics, one of the first genes discovered in genomics was complement factor H for macular degeneration. And now we're seeing a new revolution in AI, and ophthalmology is really on the forefront of that. And it's interesting that Dr. Eric Topol, who is an expert in big data, he's a cardiologist here in California, has himself stated that ophthalmology is really on the cutting edge of artificial intelligence. What can artificial intelligence do for ophthalmology? Many things. I'm a glaucoma specialist, and in our field there are many gaps in glaucoma care. If you put 5 experts in a room and you showed them images of an optic nerve, there'd be considerable disagreement about whether or not that optic nerve constitutes glaucomatous damage or not. It's kind of surprising that that's the case, but it's true. In the realm of visual field testing, we would love to have an algorithm that could objectively detect visual field progression. And what we're seeing outside of glaucoma, explosions in the area of artificial intelligence. Recently, the FDA approved IDX, which is an autonomous algorithm for detecting referable diabetic retinopathy. And now you're seeing an explosion around the world using that method or related AI algorithms to detect diabetic retinopathy, which is really critical because we have an epidemic, so to speak, of diabetic diabetes, and we have a relative lack of manpower to identify patients who might have diabetic retinopathy and need treatment. And we all know that diabetic retinopathy is a treatable disease. And so the sky is the limit about what AI could do next. In my field, it would be wonderful if AI could predict, and I think that it could predict which patients are going to be rapid progressors, which patients might need surgery, what would be an appropriate target intraocular pressure for treatment of the disease, etc. So there's a tremendous amount that I believe AI still can do in our field.